For people in recovery from addiction, help during the coronavirus crisis is just a click away.
The recovery community is not taking a day off.
Northampton County Drug and Alcohol has organized virtual sobriety meetings through both of its recovery centers, Change on 3rd Street in Easton and Change on Main in Northampton. Brian Sabo is the program director of both centers.
What is Change on Main and Northampton County doing right now to help people access all of your resources?
Okay, so as of now, we're acting as a hub. We're taking telephone calls and working through social media. So we've been connecting online meetings, virtual meetings on the Zoom app.
He says in the past, both locations have offered over a dozen in-person sobriety meetings each week. Now they're hosting an average of 50 virtual meetings per week.
Typically throughout the week here at Change on Main, I have anywhere between 250 and 300 people come through our doors. Between meetings and social events we have, it's literally in the Lehigh Valley, thousands of people are just getting together through these Zoom meetings as we speak now.
Rhonda Miller is a certified family recovery specialist who manages Oasis Community Center in Bethlehem, which provides support and resources to the family and friends of people struggling with addiction. She says it's critical for people in recovery to stay connected while following stay-at-home orders.
Somebody could be going through recovery right now and they could be just in their apartment by themselves, and that's not really ideal.
It's very unfortunate. It's dangerous, but I would just encourage these people to avail themselves to the many, many resources that are out there. There's a lot of anxiety, and families feel that anxiety when their loved ones are struggling. There's concerns. Their loved ones are no longer able to connect with their personal support groups face to face.
Sabo says too much stress and anxiety can contribute to a relapse.
I've been sober for just about 8.5 years. And this added stress, I've learned how to cope with stress, but this is a type of stress that's beyond anybody's imagination. And what I've been doing personally is making more phone calls than I do normally throughout the day and night.
Do you foresee people relapsing due to the added stress?
Boy, that's a tough question. I mean, I would like to think not, but certainly it's possibilities through phone calls and social media that they can stay in contact with people when they're struggling and get through that couple of minutes it takes to relieve that thought.
Miller says the entire recovery community has an all-hands-on-deck mentality right now.
Addiction is a very strong disease. We've turned to technology, as everybody has. I have daily Zoom meetings every day so that I can offer ongoing support and continue to build the community that we've built.
And people like yourself, as far as you know, nobody's taking a day off. Everyone's like, we've got to work even harder now.
Yeah, our work schedule has expanded.
You can find a full list of virtual recovery meeting options on PBS39.org. Reporting in Bethlehem, Pennsylvania, I'm Megan Frank, PBS 39 News Tonight.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.
For all of us, it could, the answer might be, I'm going to escape from this.
Coronavirus is affecting all aspects of life. For someone recovering from addiction, the change in routine could be detrimental. Some people would go to group meetings every day. Now that those meetings are canceled, some are taking the group online.
People are setting up their own online meetings. The thing with that is not everyone is technology savvy, so I think there's still many people that are affected here.
County officials are also working on a way to accommodate online group meetings. Dunwoody has been in recovery and clean for more than 5 years. He tells us the isolation facing others in recovery is a real concern.
Isolation is a trigger for people, to be alone in their own thoughts, and especially with the fear that people have of the unknown. It's just a very stressful time. I think just asking someone, like, are you okay?
Carbon Monroe Pike Drug and Alcohol in Lehighton is making some changes to the way they support their patients. The administration building is only open to essential personnel, and business is being conducted over the phone.
We had canceled our groups to minimize the amount of people that there were in the building and the large gatherings. We saw people individually. Tuesday, the 17th, we actually began to do telephonic sessions with the outpatient staff here in the office.
Helping somebody through recovery over the phone definitely has its downfalls. You can't read somebody's body language, and then there's the isolation that we spoke about. However, there are also some upsides.
Over the telephone, individuals will have kind of that false sense of security where they can let their guard down, their fears of going into public because of the COVID-19, and also, like I said, because of transportation. So as long as they're able to pick up the phone.
If you or someone you know could benefit from the Carbon-Monroe Pike Drug and Alcohol, or want to know more about the precautions they're taking, you can reach out to the office or visit cmpda.cog.pa.us. In Lehighton, Carbon County, I'm Ben Stemrick, PBS 39 News Tonight.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.